Today, we're diving into a topic that's crucial for every cell in your body: cholesterol. If you're over 60, this information is critical. Cholesterol is both essential for life and potentially dangerous to your health. In the next few minutes, you'll discover why it's so important and learn about the surprising signs of high cholesterol that many seniors overlook. We'll uncover why these signs are critical to recognize. Stay with me to uncover hidden warnings your body might be sending before it's too late. This could be the most important health information you hear all year. But before I continue, please consider liking this video and subscribing to our channel. We appreciate your support. Now let's get back into the video. Let's talk about these sneaky signals that many seniors might be missing. Have you ever noticed small yellowish bumps on your skin or around your eyes? These little bumps could actually be cholesterol deposits, known as xanthomas. They're like tiny billboards your body is putting up saying, "Hey, check your cholesterol levels." Now you might be thinking, "But I've had these bumps for years and my doctor never mentioned anything." That's because xanthomas are often overlooked even by healthcare professionals. But here's the thing, these harmless looking bumps could be a sign of very high cholesterol levels. But wait, there's more. Have you noticed any changes in your vision lately? I'm not talking about needing stronger reading glasses, I'm talking about something a bit more unusual. A white ring around your cornea. This condition, known as corneal arcus, could be another sign of high cholesterol. Now, before you rush to the mirror to check your eyes, remember that corneal arcus is more common in older adults and doesn't always mean you have high cholesterol. But if you do notice it, especially if you're under 45, it's definitely worth mentioning to your doctor. It's another post-it note your body might be leaving for you. There's one more sign that often gets overlooked, and it might just surprise you. Have you been experiencing unexplained leg pain, especially during physical activity? You might have chalked it up to getting older or being out of shape, but what if I told you it could be a sign of something more serious? This kind of leg pain could actually be a symptom of peripheral artery disease, or PAD, which is linked to high cholesterol. When you have PAD, plaque builds up in the arteries that supply blood to your legs. This can lead to reduced blood flow, causing pain or cramping when you're active. It's your body's way of saying, "I'm not getting enough oxygen down here." Now, why are these signs so crucial for seniors to recognize? Well, here's the thing. Many older adults might brush off these symptoms as just part of getting older. But by ignoring these signs, you could be missing out on important clues about your health. Think about it this way, if your car's check engine light came on, you wouldn't ignore it, would you? Well, these subtle signs are like your body's check engine light. They're telling you that something might need attention. So next time you notice an unusual bump, a change in your vision, or unexplained leg pain, don't just brush it off. It might just be your body leaving you an important post-it note about your health. Now, how could something your body needs also be so dangerous? It's like having a helpful friend who suddenly turns into a troublemaker. That's the story of cholesterol in our bodies, especially as we age. Let's unravel this mystery together and discover why managing cholesterol becomes more crucial and more challenging for seniors. Cholesterol isn't all bad. In fact, it's essential for our bodies to function properly. This waxy substance plays a vital role in building cell membranes, producing hormones, and even helping our bodies make vitamin D. Without cholesterol, our bodies would struggle to perform these crucial functions. Here's where things get interesting. Your liver is like a cholesterol factory and filter all in one. It produces about 80% of the cholesterol in your body and manages its levels. The remaining 20% comes from the foods you eat, especially animal products like meat, dairy, and eggs. As we get older, our body's ability to regulate cholesterol changes. The liver becomes less efficient at removing a certain type of cholesterol from our bloodstream. This type is called low-density lipoprotein, or LDL cholesterol. When there's too much LDL cholesterol in our bloodstream, it can start to build up in our arteries, forming plaque. It's like traffic building up on a busy highway, slowing everything down. While LDL causes trouble, HDL works tirelessly to keep things in order. HDL, or high-density lipoprotein, is what we often call good cholesterol. It helps transport excess cholesterol back to the liver for elimination. Imagine it as a fleet of tiny trucks clearing away the excess cholesterol from our arteries. Now, here's where it gets tricky for seniors. The balance between HDL and LDL is crucial for our cardiovascular health. As we age, maintaining this balance becomes more challenging. Higher levels of LDL cholesterol can increase the risk of heart disease and stroke, which are major concerns for older adults. That's why it's so important for seniors to keep a close eye on their cholesterol levels. High cholesterol doesn't usually have obvious symptoms. You can't feel it building up in your arteries. It's like a stealthy intruder quietly causing damage without setting off any alarms. Regular cholesterol checks become crucial as we age. It's not enough to rely on how we feel. We need to be proactive about monitoring our cholesterol levels to manage our cardiovascular health effectively. Think of it as regularly checking the oil in your car. You might not see any immediate problems, but regular checks can prevent major issues down the road. You might be thinking, wait a minute, I thought high cholesterol was silent. Well, you're not entirely wrong, but here's something that might surprise you. While high cholesterol doesn't usually announce itself with flashing lights and sirens, your body might be trying to tell you something after all. It's like your body is leaving you tiny post-it notes, but we've been too busy to read them. What if your body is sending you signals about your cholesterol that you're completely missing? Turns out the silent killer myth could be putting seniors at unnecessary risk. Nearly half of adults aged 65 to 74 have high cholesterol, and many are mistaking the symptoms for normal aging. It's time to bust this myth wide open. For years, we've been told that high cholesterol is a silent threat, but for seniors, this belief could be more dangerous than the cholesterol itself. Why? Because it's leading many of us to ignore important signals our bodies are sending. Think about it. How many times have you heard someone say, "Oh, that's just old age catching up with me"? We've all done it. A little leg pain here, some fatigue there, it's easy to chalk it up to the years adding up. But what if those normal signs of aging are actually your body's way of waving a red flag about your cholesterol levels? So what does science tell us? Experts at the Mayo Clinic warn that high cholesterol can lead to fatty deposits building up in your blood vessels. Over time, these deposits can cause blockages, potentially leading to heart attacks or strokes. That's a risk none of us want to take, especially as we get older. But here's an interesting twist. Some experts suggest that while high cholesterol is definitely a risk factor for heart disease, it might not always be the most critical issue for elderly patients. Some folks who reach their golden years with high cholesterol might have other protective factors or genetic advantages working in their favor. Now, before you go reaching for that extra slice of bacon, hold up. This doesn't mean high cholesterol is harmless. It just means that our bodies are complex, and managing our health as we age requires a nuanced approach. The real danger of buying into this silent killer myth, by ignoring these subtle signs, we could be setting ourselves up for serious health complications down the road. Your body is smarter than you think. It's constantly communicating with you, sending little signals about what's going on inside. Here's the bottom line. That fatigue you've been feeling or those unexplained aches might just be your body's way of saying, "Hey, let's get that cholesterol checked out." Don't brush off these signs as just part of aging. Listen to your body. It might be trying to tell you something important about your cholesterol levels. Have you ever looked at your cholesterol test results and felt like you were trying to read a foreign language? Well, you're not alone. Many seniors are using outdated information to interpret their cholesterol numbers, and it's time we decoded this health mystery together. Let's start with the surprising fact that cholesterol numbers that are considered normal for a 30-year-old might not be right for you. As we age, our bodies change, and so do the ideal ranges for our cholesterol levels. It's like your body's fuel gauge. What was once a full tank might now be running on reserve. Here's something that might surprise you. After 65, higher total cholesterol might actually be protective. Some studies suggest it's like your body giving you a little extra cushion as you age, but don't break out the cheese platter just yet. We still need to keep an eye on that LDL or bad cholesterol. So what number should you be aiming for? Let's break it down. LDL or bad cholesterol should be below 100 milligrams per deciliter. HDL or good cholesterol should be 40 milligrams per deciliter or higher. Triglycerides should be less than 150 milligrams per deciliter. Think of LDL as the troublemaker in your blood and HDL as your body's cleaning crew. But remember, your ideal numbers may differ, so treat these as guidelines, not rules. Now you might be wondering, how often should I check these numbers? Current guidelines suggest annual cholesterol tests for people over 65. It's like checking your car's oil. Regular maintenance can prevent bigger problems down the road. Here's something you might not know. After 65, your liver's ability to remove LDL cholesterol decreases. It's like your body's filtering system is working overtime but not quite keeping up. This can lead to higher levels of bad cholesterol if not managed properly. Many seniors aren't aware that their cholesterol numbers can be interpreted differently than those of younger adults. This lack of awareness can lead to potential health mismanagement. That's why it's crucial to stay informed and work closely with your healthcare provider. Remember, cholesterol management isn't just about the numbers. It's about your overall health and quality of life. It's like a puzzle, and your cholesterol levels are just one piece. Other factors like diet, exercise, and family history all play a role in the big picture of your health. So, what's the takeaway? First, don't panic if your cholesterol numbers aren't what you expected. Second, make sure you're getting regular checkups and discussing your results with your doctor. And third, remember that your ideal cholesterol levels might be different from what you've always thought, and that's perfectly normal. Stay informed, stay healthy, and keep decoding that cholesterol code. Have you ever thought of your cholesterol levels as your body's check engine light? Well, for many seniors, that light might need checking more often than you think. I've spent weeks researching cholesterol testing for older adults, and what I've discovered is eye-opening. Did you know that 70% of adults over 65 aren't getting their cholesterol checked as often as they should? That's more than 2/3 of seniors missing out on crucial health information. As we age, our bodies change, and so do our health needs. The annual cholesterol test you're used to might not be enough anymore. The National Heart, Lung, and Blood Institute recommends that adults over 65 get their cholesterol checked annually. But here's the thing, this is just a general guideline. Your doctor might suggest more frequent tests based on your individual health profile. If you have a family history of high cholesterol, heart disease, or other risk factors like diabetes or high blood pressure, you might need to check your levels every 3 to 6 months. On the flip side, if you're in great health with good previous results, you might go a bit longer between checks. More frequent tests aren't just about catching high cholesterol early. They're also about monitoring how well your treatments are working. If you're taking medication or have made lifestyle changes, regular checks can show you how effective these efforts are. For those with a history of heart disease or stroke, frequent cholesterol checks are essential. Your doctor might want to see you every few months to keep a close eye on your levels. Now, I know what you're thinking. All these tests sound like a hassle, but trust me, it's worth it. Regular cholesterol checks can catch problems early before they turn into something more serious. Plus, these tests are an opportunity to check in with your doctor and make sure you're on the right track, so don't assume your annual cholesterol check is enough. Talk to your doctor about how often you should be getting tested. Be honest about your health history, lifestyle, and any symptoms you're experiencing. Remember, taking care of your health is a team effort. You and your doctor are partners in keeping your cholesterol and your overall health in check. High cholesterol is often called a silent killer for a reason. You could be feeling great while your levels are creeping up, putting you at risk for serious health problems. That's why regular checks are so important. They're like a regular tune-up for your body, helping you stay on top of your health and catch any issues before they become major problems. Have you thought about how much of a difference managing your cholesterol could make? Well, here's something that might surprise you. Taking charge of your cholesterol levels could slash your risk of heart problems by up to 50%. That's right, seniors who actively work on keeping their cholesterol in check are giving themselves a huge health boost. Your cholesterol story is unique, fitting into your overall health picture. Regular checkups with your doctor are crucial to understand your personal risk factors and create a tailored plan. Imagine a future where every heartbeat echoes strength and vitality. By paying attention to these important signals and taking action today, you're investing in a healthier, happier tomorrow. Your future self will thank you for it. Thanks for watching and subscribing to our channel, and remember, the best of your healthy golden years are ahead of you. See you in the next video.